Good evening, I'm Psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, you may call me here in the Fort Wayne area by dialing 969-2720, or if you're calling anyplace else coast to coast, you may dial toll-free at 866-969-2720. Now on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with a question I recently received. It reads, Dear Dr. Fawver, I think my son may be starting to show signs of attention deficit hyperactivity disorder, ADHD. Is there a certain age where it's more beneficial to see a psychiatrist? Could it be too soon, or could he grow out of it? Well, the bad news is that if people have ADHD as children, and it's a valid diagnosis, about 90% of them do take the condition into the later years as an adult, often in a different way. In other words, as a child, you'll often have more hyperactivity, impulsivity, more difficulty controlling your actions, and you say things and do things you shouldn't be saying and doing. Later on in life, that often will fade and settle down some, but you'll often still, as an adult, have trouble with concentration and focus, especially if things are not interesting, challenging, or novel, or exciting. So you can have different types of ADHD symptoms going into the adult years. When does it start? Typically by the time you're in middle school. As a general rule of thumb, 12 years of age is the baseline where you need to see ADHD more often than not before you call it ADHD later on in the adult years. How young can you go? I would defer that to my pediatric colleagues as well as child psychiatrists. Depends on how impairing it is. Now, if you think about ADHD being like visual impairment, with visual impairment, people sometimes have nearsightedness to the point where they need to have eyeglasses all the time. Other people have vision disturbances where they only need to wear eyeglasses upon reading, so they just use them periodically. That's kind of how ADHD can go. You can have very severe forms where it can be impairing, and I think impairing for your child would be where he or she is having difficulty in the school environment academically and socially. So a lot of children with very severe ADHD, they don't get invited to sleepovers. So they have trouble really maintaining friendships and being able to socialize. And you don't want that going on year after year after year necessarily. You also don't want to get them behind academically. So it's all a judgment call on the degree of impairment. With ADHD, I'd also take a look at the family members, the father, mother, brothers or sisters for that matter. Did they have ADHD? Was it impairing for them? How did it affect them? And how were they treated, with medication or with behavioral techniques? So not only does ADHD strongly run in families, it's the second most highly prevalent medical genetic condition there is. Psoriasis, a skin condition of psoriasis, is the number one genetically transmitted medical condition we have, but ADHD is number two. So it's highly genetic, and I'd want to know how family members did when they were younger, when they were a similar age, and how they were treated, and how, if any, to what degree it did impair them. Thanks for your call. Let's go to our first caller. Hello, Robert. Welcome to Matters of the Mind. Robert, you had mentioned that high blood pressure runs in your family, and you've recently been prescribed Cobenfy. Should you be concerned? Cobenfy is a medication that can increase the blood pressure when you're taking it in about 1 out of 10 people. 9 out of 10 people won't have the increased blood pressure. Why do you have increased blood pressure with Cobenfy? Quite simply because Cobenfy is a combination of two medications, one of which, xanomeline, which will directly stimulate two receptors. They're called muscarinic receptors, and in doing so, they work entirely differently than any antipsychotic medications we've ever had. The antipsychotic medications we've been using for the past 70 years primarily have blocked dopamine, and that's how they worked. And in doing so, they gave side effects, and they worked some, but they didn't work the way that both Cobenfy does. Cobenfy works more on acetylcholine, so xanomeline is a medication that was used specifically for that purpose. Here's the problem with xanomeline. It will increase acetylcholine, and doing so indirectly will decrease dopamine, but it also, by increasing acetylcholine, can cause people to have horrific nausea and diarrhea. So how do you get around that? Trospium. Trospium is a anticholinergic medication. It blocks acetylcholine just in the body, but not in the brain. That's the beauty of it. So it doesn't interfere with the good effects of xanomeline in the brain, but trospium will block all the peripheral body side effects that people can have. So in that way, you don't have diarrhea, don't have nausea. However, by blocking acetylcholine at the heart level, yeah, you can have a faster heart rate, and sometimes that's associated with higher blood pressure. So it could exacerbate or worsen blood pressure in about 1 out of 10 people, but 9 out of 10 people it doesn't. So if you have a family history of blood pressure disturbances, that is not a warning and precaution on xanomeline or Cobenfy for that matter, in terms of not using it. You can go ahead and use it. If the problem arises, it can be managed at that time. Thanks for your call. Let's go to our next caller. Hello, Terry. Welcome to Matters of Mind. Terry, you want to know about irrational fears. Why do you have them? Well, irrational fears, it sounds, Terry, it's where you have fears that don't make a lot of sense. Many times there's phobias and there's worries. So there's different types of fears. So let me talk about phobias first. Phobias will be an irrational fear of something in the environment, and it can be a phobia of flying, it can be a phobia of snakes, it can be a phobia of all sorts of different things. Instinctually, we are supposed to have fears of things that can be dangerous in our environment, but sometimes you can exaggerate how dangerous a situation can be. So an example being, if you were to fly in a jet and you're going off to New York City and you're flying, yeah, for some people that can be dreadfully frightening because they think about the what if of the plane crashing. But we all now know that flying to New York City is a lot safer than driving to New York City. I'm just talking about the transportation itself. I'm not talking about what happens once you get there. But flying is a lot safer than driving in general. So if you can think through those different fears and think through the reasons why you might have phobias, that can often be a start. Many people have worries about things that don't make a lot of sense, and those are worries that sometimes they can be obsessional, where you know it doesn't make any sense. And if it's an obsessive compulsive disorder, that can be related to a past childhood history of a lot of strep infections. Some women, after they deliver a baby, will develop OCD, obsessive compulsive disorder, where they have obsessions about especially cleanliness. And it goes over the top to the point where it becomes impairing, and that can go on for several months after delivery. So there's different type of irrational fears where you can have phobias, where you're afraid of something in particular. Often it's because you've had some exposure to that in the past and you've kind of made up in your mind that it's very dangerous. You can have worries where you can have fears about the future, the what if, where you have a lot of doubts. Many people will be fearful of things happening in the future that, well, quite frankly, they look back on it and nothing ever happens. And for those reasons, I'll often recommend to those people that they keep a diary of their main fears on a day-to-day or week-to-week basis. Write down what your main fears might be. Then go back and look at those fears 3 months, 6 months, even a year later. And you'll often find the things that you were finding fearful today, well, it doesn't amount to much in the future. You overcame them. They kind of dissolved and went away on their own, or they just didn't come about. So then you have those kind of fears. And then you have the fears where it's called obsessive compulsive disorder, where you have these irrational thoughts that go through your head, various reasons for that, but it's because of a circuit in the brain getting a little bit off kilter. And the best way to get rid of those kind of particular fears is to talk yourself through them. The obsessional fears that people can have, where they're just totally irrational thoughts, kind of talk yourself through them and verbally tell your brain to stop. You don't want to do it necessarily out loud when you're in public, but if you have an obsessional thought that's just going round and round and round, there's something that happens to the brain circuitry. It's really interesting. If you just say out loud, stop, you can sometimes get the needle back on the groove where it needs to be, because for a lot of these people, when they have obsessions, it's like the needle's getting stuck and they just have the thought going round and round and round. And if you can verbally say stop, kind of in a quiet, private area, that can often throw that obsession off. Thanks for your call. Let's go to our next caller. Hello, Cindy. Welcome to Matters of the Mind. Cindy, you want to know what kind of things should you avoid that would worsen your depression? Right off the bat, I'm thinking alcohol. Anything you're trying to do to self-medicate your depression can often make it worse. You want to still get your sleep. So if you're having depression, you don't want to stay up at night and watch late night movies. And we've had the basketball tournament going on recently. You don't want to stay up and watch late night basketball games. So you don't want to do anything that's going to interfere with your circadian rhythm. When you're going through a lot of changes and you're starting to have depressive symptoms, It's a fine line, but I'm always warning people, don't make too many changes in your life at one time if you're going into a depressive episode. So depression can be triggered by a lot of changes that are difficult in which to manage. By definition, will be stress. So a stress is basically where you're having trouble with a change and you're having trouble coping with it. So you want to be careful about too many changes going on at one time if you're going into an episode of depression itself. You want to be very careful when you're going through an episode of depression of what you're eating. You're going to crave carbohydrates. There's a biological reason for that. If you blast your brain with carbohydrates, it will increase the influx through the blood-brain barrier of tryptophan. Tryptophan goes to the brain, creates serotonin. Serotonin gives you a little bit of a calming effect, and you feel better. So sometimes people will try to eat their way through a depression with a high carbohydrate diet that makes them feel worse in the long run, but temporarily gives them kind of a soothing effect. So be careful with alcohol, marijuana. Be careful with the changes going through your life day to day. Try to stay physically active, because when people get depressed, they want to withdraw more. And be very careful of your diet when you're going through depression itself. And try to eat more of a high carb. We sometimes call it a ketogenic diet. It's where you're eating more, high protein diet, a high protein diet, low carb diet. It's called ketogenic diet. It's where you're trying to limit your carbohydrates and increase your protein and fat consumption for that matter. That's often the best type of dietary means of treating depression, but it's what people often don't want to do when they're depressed. When people are depressed, they want to kind of binge out on carbohydrates, and that's why they often gravitate toward junk food. Often makes the depression much worse. When people have depression, especially in the wintertime and as we go into the springtime, try to get outside some and get some sunlight periodically. Sunlight is remarkable for the brain. It helps wake the brain up. If you stay inside and you're more seclusive, the dark days of the house can be more depressogenic for a lot of people. Thanks for your call. Let's go to our next caller. Hello, Stan. Welcome to Matters of Mind. Well, Stan, you mentioned that you're having trouble waking up too early in the morning, and it's causing you to have brain fog. Is there anything you can do to help sleep through the night? Brain fog is a phenomenon where you have a hard time thinking, and you have a hard time processing information quickly, and it can be due to awakening too early. So I'd want to know, okay, what might be exacerbating or contributing to your awakening too early? It's called terminal insomnia. When people have terminal insomnia, it can be an underlying symptom of depression. When people have a clinical depression, many times they will awaken too early in the morning. It's because as you go through the night, you tend to dream more and more, and your dreams are more intense. So as your dreams get more intense, sometimes in the early morning hours, you'll wake up because, whether you know it or not, you're having pretty intense dreams. Can be a symptom of depression itself. So that's something in which you could be assessed. You can always check with your primary care clinician to see if there's anything you can do to sleep through the night for something going on. For instance, if you smoke cigarettes, nicotine, very typically you'll have your last cigarette close to bedtime. After 2 or 3 hours, the effect of the nicotine's wearing off and you wake up because you're in nicotine withdrawal. So nicotine withdrawal will contribute to early morning awakening. Same with alcohol. Some people will have a drink or two before they go to sleep. It'll put them to sleep, but it gives you disruption in the efficiency of your sleep itself, and that includes awakening early in the morning. Sometimes you have to look at your surroundings. Well, do you have a neighbor who has a barking dog in the early morning hours? Is that keeping you awake? So certain little things like that might be a factor. Yeah, we do use medication to help people sleep throughout the night if we don't identify these other factors. Gabapentin, trazodone, these are medications commonly used for people. They work for about 8 hours, so they don't just work for 2 or 3 hours like a medication like Ambien or Zolpidem will do. They'll work throughout the entire night. So sometimes people need to do that. You're exactly right. You can have brain fog by not getting enough sleep. I'd also wonder if you're having difficulty with sleep apnea. Sleep apnea is where you're snoring, where you're pausing in your breathing periodically at night. If that happens, you're not getting enough airflow to the lungs and thereby not getting enough oxygen to the brain. Sleep apnea gets worse when you're dreaming. So as the night goes on, many times as people get more dream sleep in the middle of the night and in the early morning hours, they'll be snoring more intensely and they'll have less airflow. That sleep apnea will actually wake them up. And it's not uncommon that people will say they awaken at 4 and 5 in the morning, and they don't want to get up till 7 a.m. or so, but they awaken, they have a little bit of gastroesophageal reflux, so they have some heartburn, and they notice that they almost feel nauseated. They have some difficulty with brain fog because they didn't get a good night's sleep, but the brain fog is also due to the sleep apnea. because sleep apnea will give you brain fog. So a lot of different things in which you could be assessed. Talk about some of your symptoms to your primary care clinician. I think he or she can kind of go through different options for you. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, my family has a history of schizophrenia. Is this something that can be passed down? Are there certain things I can look out for? Schizophrenia is about 50% genetic. So if you have an identical twin, a twin with your exact same chromosomes, living in the same environment or even living in different environments, about a 50% chance of you getting schizophrenia if your identical twin has schizophrenia. So it's about 50% genetic. If you have a parent, a mother or father with schizophrenia, your chance of having schizophrenia is 12%. If you have a brother or a sister with schizophrenia, your chance of having schizophrenia is 8%. So the good news is if you have a mother or father with schizophrenia, yeah, your chance of having schizophrenia is 12%, but your chance of not having schizophrenia is 88%. What can you do to break the cycle? It's very important. Number one, try to maintain socialization in a healthy social environment in your childhood environment and going through your adolescent years. Very, very, very importantly, and I emphasize this for quite commonly to people who are adolescents who have family members who have schizophrenia, never, never, never smoke marijuana. I know it's getting legalized, it's getting recreationally legalized in many, many states, but don't touch cannabis. Cannabis is a major trigger for the onset of schizophrenia for people who, quite frankly, might not have developed it. It's not that cannabis all by itself will promote schizophrenia, but if it will sometimes provide the spark to create the psychotic symptoms for somebody who is prone to developing schizophrenia. In other words, if you have a can of gasoline in your garage, that can of gasoline is perfectly fine sitting there unless you throw a spark or a match at it and then it can explode. Okay, having genetics for schizophrenia, well, that could be very latent for you, and those genetics might actually eventually extinguish because nobody's developing the symptoms over the course of time. If you have anything that's going to provoke or exacerbate the schizophrenia symptoms, that's what you want to try to avoid. So maintaining a healthy environment, trying to be assessed for anxiety and depression as an adolescent, if that's an issue, the sooner we can start to treat people with so-called premorbid schizophrenia symptoms, the better. So the key will be to try to jump on any possible symptoms of anxiety, social awkwardness, hearing things in the background. Those are all called pre-psychotic symptoms, and we try to address those as soon as possible. Thanks for your call. Let's go to our next caller. Hello, Vince. Welcome to Mayor's the Mind. Vince, you had just started taking duloxetine, also known as Cymbalta. How do you know if your symptoms are getting better? Cymbalta became approved by the Food and Drug Administration back in 2002, I believe, for major depression. It's since been approved for fibromyalgia. So it's basically increasing serotonin and norepinephrine at a ratio of about 6-to-1, roughly. So it's increasing both serotonin and norepinephrine. And in doing so, it can help with depression, and it can help with fibromyalgia and aches and pains. How do you know if you're getting better? It depends on what symptoms are being addressed. On one hand, you can subjectively just try to scale yourself on a scale of 0 to 10, how you're feeling. 10 being the best, 0 being no help at all. How's the Cymbalta doing? If you can think about how you felt before you took the Cymbalta and then go up the scale of up to 10 in terms of how much better you feel with it, that's a subjective assessment. We do use questionnaires very, very commonly looking at very specific symptoms. So we look at symptoms of depression, anxiety. These questionnaires give us a numerical score on how you're recovering. So as clinicians, if we use questionnaires, we can sometimes gauge just how you're doing, but your subjective response itself, where you've identified, okay, what are your goals for treatment? Based on those goals, duloxetine was prescribed to you. How are you doing in terms of addressing those goals? And it's basically a subjective experience, but we have ways to objectively assess it with the questionnaires. Thanks for your call. Let's go to our next caller. Hello, Kim. Welcome to Mayor's the Mind. Kim, you had mentioned that last month you had a mental health crisis. What are some of the things you can do outside of therapy to support your recovery. With a mental health crisis, depends on the nature of the mental health crisis. Kim, if it was a serious psychosis, that's like having a seizure. You want to get that assessed and get that settled down, typically with medication. So medication can help with functionally impairing symptoms such as psychosis, a manic episode, a severe depressive episode that was functionally impairing. You don't want to allow that severe mental health crisis to linger because you can be less resilient. In other words, you'll have more difficulty putting up with stuff in the future if you don't get that under control. Therapy is an option. Talk therapy is an option. What can anybody do in terms of trying to help with their mental health? As I mentioned before, trying to be careful about your carbohydrate intake with more of a ketogenic diet where you have a low carb, high protein, higher fat type of diet. Mediterranean diets have been discussed for a long time, eating like they do on the Mediterranean. So your diet can be a factor there, and exercising, staying socially active is often very, very helpful. Maintaining a diary of your mental health symptoms can be very helpful. You're going through a mental health crisis, write down what's going on, write down how you're feeling, how you're tolerating it, and then the good thing about that will be you can go back 3 months, 6 months from now and look at how you dealt with that, and look at how those stresses, those circumstances that were affecting you so prominently recently, how they're doing later on, how they're doing 3, 6 months from now, because you might find, number one, you overcame them, and number two, they kind of have evaporated on their own and they didn't become as big of an issue for you as you might have thought. We all go through stresses, we all go through changes, we all go through tough life circumstances, but what's very important is how resilient we are in adapting to them and how we do in terms of getting them under control. Thanks for your call. Let's go to the next caller. Hello, Jerry. Welcome to Matters of Mind.
Yes, I was wondering, would anxiety or anything cause neuropathy to get worse? I take trazodone and gabapentin, and I get like irritated or like an itchy burning feeling in my feet and base area.
Jerry, gabapentin's used for burning in your feet. So gabapentin's used for those type of problems. But are you saying the trazodone or the gabapentin might be causing some of those symptoms?
That's what I was wondering if it could be.
Gotcha. And the answer is yes. I mean, trazodone breaks down into a chemical that does stimulate this particular serotonin receptor that sometimes will cause people to be kind of restless and agitated. It's not a common side effect, so it's fairly uncommon, but it can happen. And if I hear about that, and I hear somebody like you, Jerry, saying, I started trazodone, and then within a few days, I noticed that a few hours after I take it, I felt worse in certain ways. And one of the ways could be more agitation, burning, uncomfortable feeling. It might be that trazodone's not the best medication for you. Gabapentin, on the other hand, rarely will cause those kind of symptoms.
Okay, I take it every night, the gabapentin.
Yeah. Gabapentin should be okay in that regard. What's the dosage of trazodone, Jerry?
It's 50 milligrams, but I only usually take a half or a quarter of it.
Good for you.
I don't take it every night if I'm tired.
Hey, I'll have you do a science experiment on yourself, Jerry. Just try it some nights, maybe at a quarter or a half. That's not a placebo effect. It will work for some people at just a quarter or a half of a tablet of a 50 milligram dosage. So that's perfectly fine to do that. But just do your own science experiment and try to figure out, okay, do you have those weird feelings in your face or your feet on the nights that you take the trazodone versus the nights you don't? Gabapentin, like I said, keep taking that night by night because that by itself might be all you need. Gabapentin works one way for your sleep, trazodone works another way, but you might be having some side effects from the trazodone, and it has to do with this little serotonin receptor. It's called serotonin 2C, and if you stimulate that receptor, you can sometimes feel kind of weird.
Okay, I was on the gabapentin. There was another medication that's somewhat like it before. The neuropathy seems to be getting worse.
How about pregabalin, also known as Lyrica, Jerry?
Yes, that's one I was on before. I don't know. It just started getting worse here in the last month, maybe.
How'd pregabalin, also known as Lyrica, how did that do for you compared to the gabapentin?
It seemed to help some with the neuropathy. I'm not sure what the neuropathy is coming from.
Yeah.
It's kind of like a hot wax burning feeling. I don't know.
Yeah, neuropathy can come from a lot of sources. It can come from an irritation of a nerve from a disc. You can have neuropathy from vitamin deficiencies in some cases, like a B12 deficiency. Diabetes is often associated with neuropathy. So, yeah, the underlying issue there would often be try to take care of the neuropathy itself, but also try to find the best medication that can allow your life to, well, be more tolerable. Lyrica, also known as pregabalin, works a little bit differently than gabapentin, which is also known as Neurontin, and sometimes people just have to find the right medication for them. Pregabalin or Lyrica is now generic, so it's much more easy for people to acquire.
Okay. I take anxiety medication too, and I just started a new one, and I didn't know if that would make it worse or not.
Usually, you know, Jerry, if you get the right dosage of gabapentin or pregabalin or Lyrica, usually get the right dosage of that. You don't need the anxiety medication itself, because Lyrica and gabapentin or Neurontin, they work really well for anxiety themselves if you find the right dosage. Jerry, pleasure talking to you. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air, you may write me via the internet at mattersthemind, all one word, at WFWA.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks for watching. Good night.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.